Sarah. We're students from Berry University. And as part of our graduate project, we've created a manual implementing PNF patterns and techniques with meditations to help reduce spasticity in post-stroke clients. So Rada's passing out the manual. Now the reason why we created this manual is because post-stroke clients have an increased chance of experiencing spasticity in their upper extremities. As we know, spasticity can cause neuropathic pain, which would eventually affect one's ability to function and obviously perform functional activities. Now, through our literature review to produce our manual, research suggests that spasticity causes increased stretch reflexes, which ultimately can limit range of motion. And through PNF, which is a stretching technique utilized to improve muscle elasticity, range of motion, and motor performance, we believe that with this manual, we will help spastic patients after a stroke. Now, once again, the reason why we created this manual is to help other occupational therapists understand about strategies that can be implemented with post-stroke clients. So this manual is for other occupational therapists to educate them on different strategies they can use with post-stroke clients through meditation and PNF patterns and techniques.
Okay, so first we're going to establish if the manual is appropriate for your client. So if you go to page 9 or 10, there should be like a decision tree, and it tells you whether or not your client is appropriate for the manual. If your client is appropriate, first you're going to establish goals and meaningful occupational activities based on the client's profile. And then you'll pick a meditation activity technique that the client prefers. And then you will implement the chosen meditation technique while performing all stretching techniques using the PNF patterns that correspond with the occupational activity selected. And then you'll implement the occupational activity using the appropriate patterns.
Okay, so first you would find out whether or not the manual is appropriate for your client. So that's what she was talking about, the decision tree on page 10 of this lengthy manual. So you just go through and you'd ask yourself those questions that are there in the boxes. Your yes or no questions, and you'll just follow it down. Is the client hearing intact with or without assistive devices? If not, then the manual is not really appropriate for them. If is their vision intact with or without corrections? If not, it's not good for them. If it does apply to them, then you would go down and you would answer those questions, and depending on the answer, you would find out if the manual is in fact appropriate for the client. After figuring out whether or not the manual is appropriate for the client, you would talk to them, and using client-centered methods, you would find out what their goals are in therapy. If they want to learn how to brush their hair, if they want to get dressed more independently, then you would figure out their goals. And we have some of the goals outlined within the manual. We have 3 ADLs, 3 IADLs, and 3 leisurely activities. Each of those activities go along with with one of the PNF patterns that are described in the manual. So after choosing if the manual is appropriate for your client and what their goal is, you would look at the meditation techniques that are on page 12. You would choose the appropriate meditation techniques and do them simultaneously with the PNF patterns, which go along with the activity that you're going to do. So for example, if you're going to do brushing your hair, you would choose a meditation technique, and along with D1 flexion patterns, you would do those both simultaneously to, the whole idea is to get them to decrease their stress and maybe be more likely to participate. So a lot of spastic patients, are grimacing and they're crying. They're really, it's a really painful thing to stretch them out. So that's the whole goal, is that by utilizing meditation techniques simultaneously with PNF stretches, the PNF approach itself will be more effective.
Okay, so after the occupational goals and meditation techniques are established, then the therapist will then look at the PNF pattern needed to complete the goal. So if you look on between page 13 and 20 in the manual, there are a list of PNF patterns, and it has the starting point and the ending point of each pattern. You all see it? Okay. So on the side you will see examples of goals. So for example, if it was a grooming activity, it will be D1 flexion, or if it was a feeding activity, it would also be D1 flexion. If it's a swimming activity, then it would be bilateral symmetrical pattern. Okay, so once the patterns are established, the therapist would perform a PNF stretch technique in the pattern in the upper extremity that's affected. So if you look on page 21, there is a table of all the stretches. And the stretches is hold, relax, contract, relax, slow reversal, hold, relax, and rhythmic rotation. Okay, all those stretches you would do simultaneously with meditation. And you would do it for the first 15 minutes of the session for 3 to 5 times a week before doing the actual goal. So after the preparatory technique, then you go on to do the actual occupation. So if you look on page 26, all the occupations, like all the IADLs, the ADLs, and leisure activities are all listed. So you would choose, those are just examples of occupations, so you would choose one of those occupations with your client. So if, for each occupation, there's a specific setting. For example, for grooming, the specific setting will be like in a bathroom or in your bedroom, and you would have a mirror in front of the client. If you're doing D1 flexion, you would have the comb sitting, the comb on the side of the affected limb, so that they can comb their hair using the D1 flexion pattern. And also, for each of them, there's like a contextual factor, so there'll be music playing in the background to soothe the patient so that they're able to do the occupation easier. And the therapist will give verbal cues, tactile cues, visual cues to help them and grade the activity up or down, depending on their functional status. We're going to actually give an example of how that would look. We're only going to use one meditation technique. We're going to use one PNF pattern and one occupation. Okay, so first the therapist would already have chosen the meditation technique, and she has chosen music, to listen to soft music. And the goal is we're gonna do combing her hair using the D1 flexion pattern. So we're just going to do the stretching technique of we're going to use the stretching technique rhythmic rotation, okay? So her weak arm would be this arm, so we're going to do rhythmic rotation, and the therapist will talk to the client, tell them what to do, and again, this is with meditation to decrease spasticity. So you'll tell the client to relax their weak arm, so I want you to relax your arm, okay? Then you would place your arms in the therapist would place their hand in the appropriate spot, and then you would tell the client, I'm going to move your arm upward and rotate it. So I'm going to move your arm upwards. How do you feel? Okay. All right. And then you're gonna hold it, and then you're gonna tell your client that you're gonna move it downwards. Rotating your arm. How do you feel? Okay. So again, you would do it to their maximum range. Like, she's healthy. So if the maximum range is right here, then you would stop there. You don't want to increase pain. So after you do the meditation technique with the actual, with the PNF stretch, then you go on to do the actual occupation. So again, we're going to do grooming of the hair, combing the hair. So we're going to do the D1 flexion pattern. So we don't have a table in front of us. So
The table.
There's a table behind it.
Oh, thank you. Thank you.
So again, I mean, if this were an actual patient, again, you want her to be seated with her feet on the floor, you know, but right now we don't have a seating thing right there. Okay. And then the therapist, in the setting, you would do it either in a bedroom, which this is simulated as a bed, or in a bathroom in front of a mirror. So before you begin, you would tell the client what you want them to do. Okay, I want you to comb your hair. Okay, I'm going to place the comb down. I want you to pick up the comb and comb your hair. And the therapist will give them an example. You want to brush your hair like this, okay? The opposite side of your head, looking in the front of the mirror, okay? Using the D1 flexion pattern. Okay. So I want you to pick up the comb or the brush and comb the opposite side of your hair. So again, she's healthy, but you can grade the activity up or down. So she might need more verbal cues, she might need tactile cues, more support. You might want to give her seating support or a chair that has arms so that she's not, you know, slouching over. And that's all. That's it.
Presentation.
Thank you. And thank you for allowing us to come.